COVID and the challenges that have come with it have been stressful, and it is starting to affect our teeth.
More than half the dentists surveyed by a prominent policy group are seeing an increase in the number of patients with teeth grinding and clenching, and also chipped and cracked teeth. Our health specialist, Kathy Walsh, talked with one dentist who has seen the need for night guards more than double in the past year.
Kate Gojkovic started a new job right around the start of the coronavirus pandemic. She's both chief of staff and chief development officer at a Denver area private high school.
It's definitely been a stressful couple months for sure, just trying to be able to make the right decision for the students and the families and the teachers.
Kate started having headaches and jaw pain.
I had some pain, in my temples. I had pain right in my jawline.
She went to her dentist and learned her tension was showing up in her teeth.
I just started really grinding my teeth at night and really clenching.
Is Kate the only one?
Definitely not. In our practice, we've seen the numbers more than double.
Kate's dentist, Dr. Kelly Santarelli, says from May 11th to November 11th of 2019, the two dentists there prescribed 19 custom night guards to stop stress grinding and clenching. In the same time period in 2020, they prescribed 44.
Some people are chipping teeth, fracturing teeth, cracking teeth in half as well. This isn't just a local thing, it's a national thing. Dentists everywhere, for the most part, are seeing the same thing that we are in our practice.
Kate has been wearing her night guard for more than a week.
I do honestly feel a difference every day when I wake up.
Pandemic stress may stick around, but Kate takes comfort in getting a grip on her grinding. I'm Kathy Walsh, covering Colorado First.